And so specifically about our program, U of A, the Edmonton program, you get very excellent hands-on experience. We have about a 2.5 to 1 staff to resident ratio, and you get operating very early on. We have very busy trauma centers, largely because our catchment area is so big. If you look at the dark gray area, so basically anything north of Edmonton gets sent to Edmonton. And we actually even extend out to parts of Saskatchewan and BC, as I've noted there. And our 2 trauma centers are very busy. And all our call is basically taken at our 2 trauma sites, which is the University Hospital and the Royal Alexandra Hospital. We have a very large volume of surgical cases, especially our senior residents get to operate a lot. And one advantage we have too is we developed at most of the hospitals a hospitalist program, and that comes in relevant later on too when I talk about our rotations. Hospitalists are basically family doctors that help us out and have interest in inpatient care, and they help us look after our inpatients at various hospitals. We overall have a very friendly and dynamic program. And the reason why we are dynamic is because we're very receptive to input from the residents and our teaching staff. Our program met all the accreditation standards in 2017. We have a very cohesive group. And we have, as of now at least, some good funding for a large number of courses. And Edmonton's a great city to live in. Our residents successfully match their fellowship programs. And to be honest, again, I don't think that's special to Edmonton. I think that's a fairly normal thing. And this is just a big list, but just to say that all our residents end up getting fellowships that they want to do. Again, I don't think this is different from many other programs. So every year we do take 3 Canadian positions. We do not take IMGs, but we do take 1 or 2 international residents that do return back to their country to work after that. So we can have anywhere between 3 to 5 residents per year. So our program's a 5-year program, like every other accredited program in this country. And we offer training in all the subspecialties you see in orthopedics. And I myself personally am an upper extremity surgeon. So that's my main focus of practice and clinical work. So what does our program look like? In your first year, you do 6 months or 6 blocks of orthopedics. So the year is actually in 13 blocks. It's each block is 4 weeks long. So you actually end up getting 13 blocks over 12 months. So you do 6 blocks of orthopedics, and you do some general surgery, some vascular surgery, ER, and CCU. Internal medicine, we're in the process of replacing that actually with a different rotation called the hospitalist care team rotation. And that essentially is doing like learning the perioperative care of orthopedic patients. That's very specific to us and not just general internal medicine. So that currently is, I guess, under review with the post-grad office, but I expect that to start happening by next July 1st, when you guys start. So the second year, you start doing some orthotrauma, some arthroplasty, which really is hip and knee replacements. Sports, so mainly shoulder and knee pathology is what you'll see. Spine, your rural orthopedics, and so we have a few rural sites that take our residents for that. You do 2 blocks of ICU and plastic surgery. And your 3rd, 4th, and 5th years are all purely on-service rotations. So you start getting into the more subspecialty rotations. So upper extremity, you spend 3 months with me. Pediatrics, you do tumor, foot and ankle, and some elective time. And in fourth year, you do your senior arthroplasty rotation, your senior sports, senior spine, do some more trauma and more elective time. And then in your fifth year, you do more peds, a little bit more upper extremity, foot and ankle, and some consolidation rotations. Questions so far? So we have a number of training hospitals, and the biggest ones are our trauma centers, are the U of A and the Royal Alexandra Hospital. And the Grey Nuns Hospital is where a lot of our elective arthroscopic surgery happens. The Misericordia Hospital right now is where our tumor rotation is based out of. The Children's Hospital is self-explanatory. And the Sturgeon Hospital is where I'm at, which is where most of the upper extremity surgeries happen. And then our rural sites, so which is mainly either Grand Prairie or Red Deer. But we're trying to expand a little bit more into more southern Alberta as well. So call coverage, again, I don't think this is much different from any other residency program across the country. You're doing mainly in-house call as a junior resident in your first and second year. And by the para or paro guidelines, wherever you end up, right, ends up being 1 in 4. Home call, you can do 1 in 3 or 1 in 4. And we're fairly strict about if you work, like home call, for example, if you end up working late and you are up all night, you treat it like you were in-house and you do not come to work the next day. So coming to work post-call is not something that we do, okay? And again, I think most of the programs across the country are like that now, but just so you know, that is definitely the rule and the culture here. And fifth year, same thing, you do home call, and we try and put you on less than 1 in 3 and 1 in 4 as you're getting ready to do your exams. Okay? And depending on what rotation you're on, there's almost always a junior and a senior, and then a staff. Fellows, we don't always have fellows, so that's a pro and a con. They can take away some experience, or they can add to your experience, but overall, fellows are a great thing. But really, we have fellows in trauma and sports, spine, but those are, I think, technically neurosurgery fellows. And we'll begin some upper extremity fellows soon in the future. And our academic program consists of a number of things, teaching rounds and also the half-day teaching. So we'll start with the half-day teaching. It's Thursday afternoons. And the topics run on like a 2-year cycle, so that you go through all the topics in 2 years, and then you go through it once more in the next 2 years. And so hopefully through a 5-year residency program, you'll get every topic at least 2 times. So that's the idea behind that. We do summer anatomy sessions in the cadaver lab. And OID is it's called the Orthopaedic in-training exam. It's like a massive multiple choice orthopedics test that is quite high stakes for Americans. And if you see my kids, that's okay, because I'm in my office and they need to grab their iPads and stuff. So anyhow, yeah. So so anyhow, very high stakes for Americans, but for most Canadian programs, it's formative for us. It's a way for you to tell yourself how you're doing in terms of your orthopedic knowledge. So rounds, yes. At the trauma sites, you do handover rounds, which again, I think is very typical everywhere you go. And when you're on the different rotations, you get teaching rounds basically in all those subspecialties. We do practice oral examinations, and those happen 2 times a year. And we actually just had one a couple of weeks ago. So I had our winter one, so that was good. Cadaver lab, we kind of talked about that. And for the incoming first years, we run a little boot camp, which really are half-day sessions aimed at just for the first years to teach you the basic orthopedic skills and principles. And every Friday morning, there are academic rounds. and they're resident-led presentations. And they're basically case-based and literature review around questions that residents will come up with as they're on rotation. And then the Department of Surgery rounds ends up happening about once every, Sharon, like once a month, once every, 2-3 months or something, right?
Yes. Mm-hmm.
Yeah, so on those Friday mornings, there'll be departmental grand rounds, and they're usually on bigger topics. We also do journal club. Again, COVID changed a lot of things. This year we didn't do any, but normally we do it at this nice restaurant where we get a really nice dinner and drinks, and we look at some papers. Our research program is very reasonable yet quite robust. And this really is to make sure that when you're done your residency, that you're a well-versed orthopedic surgeon, at least being able to understand literature and understand research so you can make evidence-based decisions as you move on in your career. And so what that involves is at your time at the U of A, we get you to start with a literature search project, essentially. So that is meant to set you up to do a bigger clinical project down the road. And then starting your second year, we get you to do a basic science project. We have a lab that does quite a bit of cartilage related research. And we have some biomechanics things that you can do. And then you do a clinical project, which most residents finish by the end of your fourth year. The requirement is that you either publish or present one of your projects nationally, which happens basically for everybody. So no need to worry about that. And we do have our own annual research day, which you'll have an opportunity to present at. And for those that are interested in doing an advanced degree while you're in residency, our Faculty of Medicine also offers that, and that's called the Clinician Investigator Program. And we always seem to have at least one resident in that program. And so right now we have one that's finishing or finished, and then another that's starting coming July 1st. So that's that's our research day. That's great. Anyone here from U of M? Yeah, that's our guest speaker one year, Dr. Ted Tefescu. He's a traumatologist, orthopod from Winnipeg. So we do quite a few social things, and so every year we have a welcome party, we do a Christmas party, the resident retreat, which typically happens at the end of January, is a nice treat too. We go to the Jasper Park Lodge, and Jasper is in the Rocky Mountains. And then at the end of the year, we do a golf tournament where we say goodbye to the fives, PGY fives, maybe roast them a bit, and welcome the new crew. And so this is our resident retreat. You can go skiing, and we play a hockey game every year. You don't need to be a pro. You can see, oh, there's Liz right there. And I see Liz is logged on here. Yeah, very good. And and Charles Bouchard, he's the guy in the Queen sweater, and he's one of our 5th year residents now. And this is our golf tournament. Another couple of our graduates. Dr. Bourne's on the right side. He's a MD, PhD, and doing more fellowships. And Brian Paul, he's now working in Toronto as an upper extremity surgeon. Resident welcome party, tug of war. Nobody broke anything, I don't think. Christmas party when we were allowed to party. So this was December 2019. Yes, just last year. So, and yes, we do a mission as well, an opportunity to go to Ecuador. And it's 4th year residents that we allowed to apply to go. And so that's a great opportunity as well. And just to mention here, so Dr. Paul, the handsome smiley guy here, he's our one of our tumor instructors, and he, as you can see, frequent submission, just does great work there. So I guess to summarize, what are the strengths of our program? I think we're very responsive to resident input. Every aspect of orthopedic training is offered here in our program. We have a very well-organized research program with reasonable outcome expectations. We really have educators that care. I think that's extremely important wherever you go. And we have the best CBD tool in the country.